So this is a long-term analysis of a trial that has been already published that showed that maintenance with lenalidomide was beneficial in terms of progression-free survival in patients with mantle cell lymphoma treated with autologous transplantation. Indeed, the long-term analysis indicates as a main result the fact that when lenalidomide is interrupted as per protocol, because the study included only 2 years of maintenance, unfortunately the benefit on progression-free survival does not look so evident as during the treatment once lenalidomide is applied. Therefore, the main message of this study is, which is indeed quite an old study because it's been conducted quite a while ago, is that in mantle cell lymphoma maintenance is critical, but probably, at least as far as we stay on lenalidomide, we probably have to prolong this kind of treatment for longer periods. However, in the new scenario, we now have possibility of combining lenalidomide with other agents, so all the discussion will be again different in new scenarios in which new molecules will be employed in this kind of schedule. And then also we are also aware of the triangle study showing that that probably autologous transplantation is no longer needed and that ibrutinib is a very powerful maintenance regimen. So all this information will be very important in the future generation of clinical studies in mantle cell lymphoma.